So the way heart surgery used to be, or the way heart surgery still is in the majority of cases, is a big open incision that basically cuts the breastbone longitudinally in half, and there's access to the heart. It was a highly invasive approach, not only from the physical standpoint, but also the psychological standpoint. I realized very quickly that that was not how my practice was going to continue for the rest of my time, and started to innovate and iterate on those things and develop some techniques and approaches that would minimize the invasion and maximize the efficacy of the procedures. So my vision for the robotics program at the University of Chicago was for it to be a world-renowned center for robotic surgery in a multi-spectrum fashion, which was unique at the time. Endoscopic means we're using a scope. We're just using a camera, and the camera can be 5 millimeters in diameter to do the operation. Now, if you add a robot, you can basically use wristed instruments that function as if they were the human hand inside. So basically the sky is the limit in terms of what you can do. We place our instruments through little 8 millimeter ports and insert this very highly magnified, extremely 3D image scope that gives you the perfect view. And we are able to effectuate the operation that we want to do without making those big cuts, which is really harder to recover from compared to other places in the body.
Patients who used to stay in the hospital for a week now go home in 2 or 3 days, and not dealing with the pain and limitation of a big chest incision. They look like they never had heart surgery, actually.
I understood the value and the benefits of Da Vinci versus open heart from the time I got in here until the following day that I got out. It was a really good experience. I went home the following afternoon with a prescription for the pain medicine, never used it. 3 days later, after my surgery, I was back on my bike, doing 15, 18 miles at a time.
So why is UChicago program unique in its range of operation? My answer, it's because they do everything. They do the mitral repair, atrial fibrillation surgery, coronary bypass, and reoperation.
We do a multi-vessel coronary bypass in a totally endoscopic, off-pump, beating heart fashion, which means no heart-lung machine, no arresting of the heart. The unique thing about a robotic TECAB, especially on the beating heart, is that the instrumentation for it has been lacking on the robotic systems. And we have been able to maintain our instrumentation to be able to continue to do this procedure for the last 13 or 14 years here at the University of Chicago. We use something called a hybrid revascularization strategy. So we do totally endoscopic bypass for the targets that are accessible with the robot, and then we will bring them back to the cath lab and do a stent later on.
The combination of these strategies really net a faster recovery, a less invasive procedure, and the ability for patients to return to their normal life much quicker.
The unique nature of our robotic cardiac surgery program makes it a destination for a lot of surgeons from around the world to come and observe. They know how to do all the procedures in an open fashion, and then they come and spend a year or two learning how to do robotics.
And then not only the procedure, the technical thing, but more importantly, I learned the mindset of a robotic surgeon.
If it can't be taught to other practitioners and other surgeons to do, then you really haven't maximized the benefit for patients. And so one of our missions is to train the next generation.
I hope to help grow the robotic cardiac surgery program and then expand more what we can do, and of course, train the next generation of surgeons like me.
The unique aspect of the University of Chicago robotic cardiac surgery program is that it provides for the best outcomes in multiple different types of cardiac illness and really allows for a much quicker recovery and a faster return to work and full activity.
Patients after robotic surgery compared to open heart surgery are recovering quicker. They are getting out of the hospital faster, they have less pain, so their recovery pathway looks completely different than open surgery versus robotic surgery.
I knew people who had open heart surgery, in some cases 3, 4, 5 months, just recovering from the surgery itself, where I understood at the time that with Da Vinci, literally it could be days or weeks and you're right back to being normal.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.